Okay, so let's go back to the beets and arginine. You can eat your way to it. You can supplement with L-arginine. However, I'm having trouble finding any real clinical data on actual increase in nitric oxide production using these two methods. Is that something that you find as well? And why is that?
Yeah, chewing beets, beetroot powders, there may be some benefit. There are testimonials, but it's oversold in terms of the actual science. The reality is more people dislike beets than like beets, so there is also the palatability
Right.
of it.
Totally.
Same with arginine. There was interest in taking a powder, high dose arginine in the past, but we've run into a few bumps in the road that there are some groups that may not be very safe to do that. Some of my heart patients are warned not to use arginine supplements.
Interesting.
After a heart attack. And what we do for arginine and citrulline is we certainly focus on a healthy diet, a plant-forward diet, but it is fitness. Fitness will boost the production of those precursors, there's a fancy word, those supply chain nutrients, so your arteries make enough nitric oxide. So 30 years ago, I might have encouraged a patient to add a lot of arginine. I have dropped that off the list completely, pretty much along with citrulline, except maybe low dose citrulline. And I've really focused more on these alternative ways, like frankly, bergamot citrus superfruit, that seem to naturally boost nitric oxide and arginine availability without flooding your body with it.
Yeah, and because speaking of the formulation, and there was a clinical study done that I shared with you about the Whitney Johns Active BPF Gold, and there were some really cool findings in there. A 55% increase in L-arginine at rest, 120% increase during exercise, which is crazy.
That's without taking arginine. That's encouraging the body to produce and make available more L-arginine
on its own. Yes, which is what I love so much about the whole line, is it works naturally with your body to help produce what it needs to, right? You're not taking anything synthetic, you're not replacing anything. So there's also up to 73% increase in nitric oxide during exercise.
Huge based observation.
Huge. Yes. Because even the things that I did see on beets, what I could find, it was maybe like a 20% sort of range at max. So that was huge. When we got that back, I'm like, okay, these are bragging rights majorly. The 24% increase in VO2 max, which obviously helps with your cardio, your endurance, and the oxygen uptake, which is really important, which obviously is part of why it helps with the arteries producing it on its own. And then a 14% lower heart rate in general, which is super valuable.
I'm going to interrupt you for a minute, because I am familiar with the pretty profound research you just quoted, but these were trained cyclists. And if you went to a trained athlete and said, I can help support your oxygen consumption to go up by 24%, they're not starting at the average person's level. They're starting way level, and they're still going up 24%.
And they're still, really, I know, that's crazy.
A remarkable finding. I will point out, if you read the paper, cholesterol fell 30 points too. And a lot of people are looking for a natural approach to controlling their cholesterol without prescription medicine. So it seemed like your product and the component from a natural plant, a natural citrus specifically, has so many benefits that really have been unreported with other substances.
Right. And if anyone wants to check that study out, it's published in the Journal of Sports Medicine and Therapy.